Shock and heartbreak in Canada's care homes, now ground zero for the coronavirus pandemic in this country. Hi and welcome to Power and Politics. I'm Vashi Capellos. Federal and provincial governments are ramping up their response to try and stop COVID-19's deadly spread in long-term care facilities, where the most vulnerable are succumbing to this disease at a startling rate. According to health officials, nearly half of the deaths in Canada so far have occurred in long-term care homes. Quebec is now investigating the deaths of 31 seniors at one home in Montreal. Premier François Legault says he suspects there was, quote, negligence in the privately run retirement home, with reports of staff running away from the facility, leaving residents unattended, unfed, and soiled in their beds. In response to this case and so many more, the federal government has laid out new national guidelines for long-term care homes, like restricting visitors, increased screening of staff, and the use of personal protective equipment like masks. So how dire is the situation inside these homes? Sylvie Morin is assistant head nurse at a long-term care home, or CHSLD in French, called Sainte-Dorte, located in Montreal. It's one of the hardest hit seniors' homes in Quebec. More than 100 residents and 50 staff have so far tested positive for COVID-19. She's home today, waiting for the results of her own test for the virus. Hi, Ms. Morin. Nice to see you. Thanks for making some time for us.
Thank you.
Let me start off just by asking you how you're feeling, how you're doing. Have you received the results of your test yet?
No, I'm still waiting. I had the test done on Thursday, and I haven't received a call yet. I still have aching pains, but in the back and the neck, and a bit of coughing, but it might be caused by stress. I don't know yet. So I'm waiting to have my result.
Any idea when you might get the results?
Well, it should be soon. They told us last Thursday would be like 3 or 4 days, so I should be getting it soon.
Tell me a bit, and our viewers a bit, if you could, about what your workplace has been like over the last few weeks.
It's been hell. It's been really crazy. It started really at the beginning of March, where we were preparing for the COVID pandemic by discharging a lot of people on my unit. It's rehab. So we're in the CHSLD, but it's a whole floor that we have rehab patients. So we sent a lot of patients home. We admitted like over 30 people during the month of March, even after we were closed on March 12th to visitors. We still admitted until March 26th. And now people are dying. It's crazy. Last week I worked 3 days before being put on quarantine, and we had 3 deaths over the 3 days, one each day. And I've been working in a CHSLD for 25 years now, and we're used to having people dying, but this is not normal. It's not normal life. The personnel gets sick. I'm scared of getting sick. We're short-staffed. They tried to put people on to help us like in the last few weeks. But it's not the same. It's not the regular people. So we try our best to do the best for the patients that are still there. And I have to say that maybe 90% of the unit I'm working on, now we have empty beds because of the deaths, but they're positive for the COVID. So it's really scary when I go to work in the morning.
Yeah, I was going to ask you how stressful it is. I can only imagine. I think it's 100 patients have been diagnosed positive, and 50 staff members have been diagnosed positive with COVID-19. What kind of stress do you feel working there?
It's scary. It's almost we're at war with something that we don't see. We're protected, but at first we weren't. We wanted those face visière, they call the face masks. But we have masks, but like a face to protect our eyes. So even somebody from my team, his brother was working in a company, and they could have sold it to the CIS de Laval, but they refused. So we bought ourselves our equipment at first. Now they furnish it. But I don't think it was taking seriously the result in the CHSLDs because, but it's scary. It's really, we don't know, are we going to get sick? Half of my coworkers on my floor have been sick. 2 doctors, last Thursday, the doctor was still on call. I'm scared to go to work. I've seen the AIDS epidemic in the 80s and everything, and it's worse. I'm telling you, it's worse because it goes so fast. Families don't have time to come and see them because it's the patient I called for on Thursday, she was dead on Friday. And I had time to call their daughter, but her daughter said, do the best that you can and make sure she's not uncomfortable. And it's been hard, but it could have been prevented. Our doctors were asked less transfers possible at the hospital. Change the codes to make them stay at the CHSLD. We would treat them at the CHSLD the best that we could, but we're not a hospital, so.
So let me just make sure that I understand. Are you saying that you think they could have transferred more patients? What do you think, I guess, would have made the situation better?
I think they were, I don't know, it's like, okay, you have to empty the hospitals. I understood that we have to empty the hospitals to make sure we have place when the patients come in. But since our unit is a rehab unit and a building that's a CHSLD, I don't think it was the solution to empty the hospital, because probably they didn't think it would be so bad, the transmission that we got. They blame it on the employees, but testing was done late. Some people asked to be tested in the employees, and it was refused at first because they said, no, you're not back from vacation. It's not the COVID. So it's a lot of factors.
So we know that the provincial government, the premier, as of the weekend, says we're going to do more for these homes. And the federal government has come out with these recommendations for standards for all the homes. What do you think needs to be done? Do you think anything can be done to sort of slow the impact of this?
Well, I think we're reacting after the fact, but I think when this is all over, they have to put more staff because they cut so many people with the other government. I'm not a politic person, but they did like a cleanup, like with Monsieur Barrette. There's missing orderlies in the CHSLDs, and they're talking now about a private place. I have to tell you, my mom and dad are both in a nursing home. My mom is in the public sector, and my dad is in the private. And I'm not more worried. In usual times, I'm confident with the care that both of them are getting, either in private and public. But I think after this crisis, we have to re-look at the quotas of orderlies in the CHSLDs. And in my job, we should be like, the ratios are not checked out. We work like that because we're like, we do it and we're used to work hard, but I'm doing the job for 2 nurses, so it's not normal, and we're not staffed enough. But it's really the orderlies that are the worst in all of that. And it's not because there's missing people. They don't. First of all, if they would pay them more, it would be better. And they like the gestion. It's not really good because they take like all of the orderlies from the CIS, and then they dispatch them everywhere instead of giving them like a full-time position in one establishment. They go in all the 5 CHSLDs of Laval. So people are sick of doing that, and that's why we can't keep our personnel. And but they need to be paid more because there are. As a nurse, they're my eyes. Then they take care of the patient at the base, and they're really important.
Okay, I have to leave it there. I'm out of time, but thank you, Ms. Morin, for your time. Appreciate it very much.
It was my pleasure, and we're hanging in there.
Yeah, we wish you all the best. Thanks for all the work that you're doing as well, and I certainly wish you all the best with your test results.
Thank you very much.
Thank you.
Bye-bye.
That's Sylvie Morin. She's the assistant head nurse at a long-term care facility in Montreal. I want to get some reaction to what you just heard. As I mentioned, the federal government has released new guidelines for long-term care homes. But given the rising death toll, do these homes need more than just voluntary guidelines? Deb Schultz is the Minister of Seniors. She joins us from Vaughan in Ontario. Hi, Minister Schultz. Good to see you. Thanks for making time for us.
Thank you very much for having me on your show, Vashi.
Minister, I just finished speaking with a nurse from a care home in Montreal. She's got 27 years experience, and she told me that right now, and the home, I should say, has more than 100 people, 100 patients who have the virus, have tested positive for it, and 50 staff members as well. And she said she feels scared going to work. She's awaiting the results of her own test result right now. And I'm guessing if I'm hearing stories like that, you're hearing a lot of stories like that too. What are your thoughts? What's going through your head as you hear these accountings of what staff and patients at long-term care homes are going through right now?
So it's definitely deeply concerning, especially some of the stories that we've heard are shocking. And we are just obviously taking all of this into consideration. And one of the reasons why we partnering with the provinces and territories. As you know, it's their jurisdiction, with the jurisdiction over long-term care facilities. And so we've been partnering. The Public Health Agency of Canada started to look at what we could put in place to try to make sure that we had better safety measures for seniors in these facilities, in these homes. And so they worked with their counterparts across the country, and they developed interim guidelines for advising long-term care facilities. And these guidelines can be used for other facilities, other homes, like seniors' homes and disability homes. And I just wanted you to know that I have my father-in-law in a seniors residence and my mother-in-law in a long-term care facility. And I have to just say how incredible the staff have been in both of those locations, in both of those homes. They've been exceptional. They've been helping us as a family stay in contact with both my father-in-law and my mother-in-law. So I want to give a shout out and a thanks to all of those frontline healthcare workers that are, and the personal support workers that are working very hard to keep our seniors safe. Yeah, especially in these homes.
Yeah, those staff are doing amazing work. No disagreement there. But do you, given, and my thoughts are with your family because it's a nerve-wracking experience right now. I know a lot of people as well who are going through the same thing, many of whom come forward to us nervous not about the staff, but about the system that it's in place. And I take your point that it is provincial jurisdiction, but these guidelines, they are just guidelines. They're not mandatory. Why not?
So, I don't think it's the right time to be, arguing over whose jurisdiction it is. We've been taking, as you know, a Team Canada approach on a variety of issues that have been brought forward as a result of this crisis. Our personal protective equipment, trying to make sure that we have enough supplies for everybody to be able to stay safe and operate properly in our hospitals, in our long-term care, in even central services. So we've been working with the provinces and territories to support them. We've been listening. I've been talking to my colleagues. So have all the other ministers, been working with their partners in the provinces and territories to find out what do they need, what can the federal government do to assist. And we've been doing that in a whole range of different areas. So, in terms of immigration, in terms of global affairs, in terms of procurement, in terms of long-term care, our public health agency of Canada worked with their counterparts and developed these guidelines so that they could give a consistent approach across Canada. These were guidelines. I was being asked by some of my colleagues in different provinces and territories, it would be helpful to have these guidelines in place because not everybody is operating the same across Canada. So this is what we brought forward, and I'm aware that my colleagues in the provinces and territories are paying close attention and are looking at how they can implement these.
I take your point on that again, but with all due respect, my question was not to insinuate there should be an argument about jurisdiction. I think for people whose family members are in these homes, they don't care if it's provincial jurisdiction or if it's federal jurisdiction. They're worried about the standards and how there are different standards depending on the home. There are different standards depending on the province. Is it not incumbent on the federal government in extraordinary times to offer more than guidelines?
Well, at this time, the guidelines are there, and they are consistent guidelines informed by evidence, informed by science, to be able to give that support to the provinces and territories. I can assure you that the provinces and territories are seized with this issue and are seized with trying to work on implementing these guidelines. And there are provinces that have already moved ahead. So we have provinces like BC that put in place several of these measures very early on and have seen the benefits in doing that. And we've now got Quebec and Ontario also engaging other provinces as well. So the guidelines are there. I don't believe you have to be coming with a hammer. There's a willingness on the provinces and territories' part to take advice from these guidelines and implement them to keep our seniors safe.
I understand that there's a willingness, certainly, but we're also seeing, as you laid out there, the results of different provinces implementing measures at different times. And today we heard Dr. Tam, for example, describe that about half the deaths that have occurred so far in homes like these. Is there a point at which the situation is just, to a degree that the federal government considers going beyond the actions that you've taken now?
Right now, everyone's engaged in this issue. There are differing conditions across the provinces. The pandemic came into different provinces at different times and is in different phases. So I don't believe, we've given the guidance, and I believe that all the provinces now are looking to those that may be a little further ahead on the importance of picking up that education, that experience, and making sure that they're applying what they need to do to get ahead of that curve. So the guidelines are there. At this point in time, I can assure you all the provinces and territories, premiers and health professionals, health ministers and seniors ministers are seized with this and working on how to implement those guidelines and keep seniors safe.
Okay, I'll leave it there. Thank you, Minister Schultz. Appreciate your time this evening.
Thank you very much, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.